I intend to take 10 minutes of the Republican time. Will you please let me know when 1 minute remains?
Senator will be notified.
I thank you, Mr. President. Mr. President, there may be a number of Americans who are switching over from the Minnesota versus Carolina football game, and they may be wondering, what in the world is the United States Senate doing coming into session at midnight on a Sunday in the middle of a snowstorm and getting ready to vote at 1 a.m.? So let me try to explain that for just a moment. The reason is that the majority leader, the Democratic majority leader, who's the only one who can set our schedule, showed up yesterday with a 400-page amendment, yesterday. This amendment had been written in secret for the last 6 weeks. The assistant Democratic leader said last week on the floor he had no idea what was in it. Of course, none of us on the Republican side knew what was in it, so almost no one here knew what was in it. It was presented to us, and then the Democratic leader said, well, we're going to start voting on it, and we're going to pass it before Christmas. Now, this is an amendment to the health care bill, which when fully implemented will cost about $2.5 trillion over 10 years, according to the Congressional Budget Office, which restructures a sixth of our economy, which affects 300 million people, which will raise taxes by about $1 trillion when fully implemented over 10 years, which will cut Medicare by about $1 trillion when fully implemented over 10 years, not to make Medicare more solvent, because as we know, it's going to become insolvent according to its trustees by 2015, but to spend on a new entitlement. And it will also shift to the states a great many expenses, so much so that our Democratic governor has said it's the mother of all unfunded mandates. The governor of California says it's the last thing we need. Take your time, get it right. But the Democratic leader and his colleagues insist that we need to bring this up in the middle of a snowstorm, write it in secret, vote on it in the middle of the night, and get it passed before Christmas Eve. Now, why would they want to do that? Well, Mr. President, I think the answer is very clear. It's because they want to make sure they pass it before the American people find out what's in it. Because the American people, by nearly 2 to 1, according to the CNN poll, don't like what they've heard about the health care bill. And when they have to start explaining what's in it, they're afraid it will be worse and it will never pass. Republicans are not the only ones who believe that we ought to stop and think about big issues before we deal with it. 8 Democratic senators, Senator Lincoln and Bayh and Landrieu, Lieberman, McCaskill, Nelson, Pryor, and Webb, wrote Senator Reid on October 6th, saying, as you know, to the Senator Reid, Americans across our country have been actively engaged in the debate on health care reform. Without a doubt, reforming health care reform in America is one of the most monumental and far-reaching undertakings considered by this body in decades. We believe the public's participation in this process is critical to our overall success. I'm quoting from the 8 Democratic senators, and they go on to say they want to make sure that the bill is on the website for at least 72 hours before we vote on it. Mr. President, this bill was given to us yesterday, 400 pages of it we hadn't seen before. 72 hours would be Tuesday, so the minimum requirement, according to the 8 Democratic senators and all 40 Republican senators, we shouldn't even think about voting on it until at least Tuesday. And then one would think we would be amending it and debating it and considering it and thinking about it and trying to find out what it actually does. According to the 8 Democratic senators, by publicly posting the legislation and the Congressional Budget Office scores 72 hours before it's brought to a vote in the Senate, and by publishing the text of amendments as they're debated, our constituents will have the opportunity to evaluate these policies. As their Democratic elected representatives, it's our duty to listen and to provide them with a chance to respond to proposals that will impact their lives. Yet, we're presented with it in the middle of a snowstorm on Saturday. We're meeting at midnight. We're voting at 1 a.m. It's demanding that it be passed, even though most of the provisions, as the senator from Maine has said, don't even begin to take effect for 4 more years. What's the rush, Mr. President? I think the rush is that our friends on the other side don't want to explain to 40 million seniors how you can cut $1 trillion out of Medicare. Now, it's exactly $470 billion over the next 10 years, but when fully implemented, $1 trillion out of Medicare, and spend it on a new program without reducing Medicare services to 40 million seniors. The director of the Congressional Budget Office has already said that for the 11 million seniors who are on a Medicare Advantage, that fully half their benefits will be affected. I think our friends on the other side don't want the American people to understand why the $578 billion in new taxes that are going to begin to be imposed next year, they're going to have a hard time explaining how that will create new jobs in America at a time we have 10% unemployed. And they really don't want the American people to find out that the director of the Congressional Budget Office said that if we put those new taxes on insurance premiums, on medical devices, almost all of them will be passed on to the consumers, and as a result, premiums will go up. There are some very strong words that have been coming from the other side about Republicans saying that this bill will actually increase the cost of health care. It's not Republicans who are saying that, Mr. President. Here's what David Brooks in the New York Times said in his analysis of the bill when he gave the reasons for it and the reasons against it this week, and came to the conclusion that if he were a senator, he'd vote against it. The second reason to oppose this bill, said Mr. Brooks, is that, and I quote, according to the chief actuary for Medicare, it will cause national health care spending to increase faster. That's right, Mr. President. We're going to raise taxes, cut Medicare, send a big bill to the state, all for what? Quote, according to the chief actuary for Medicare, it will cause national health care spending to increase faster. So if you're paying X for premiums, you're going to be paying more as a result of this bill. Health care spending continues David Brooks, is already zooming past 17% of our gross domestic product to 22% and beyond. Then it's going to be hard to explain to the 9 million people that the Congressional Budget Office letter said would lose their employer insurance under this bill why that will happen. Of course, it will happen because under the bill as a whole, as employers look at the mandates and the costs, many will decide not to offer health insurance, and so those employees will find themselves either in Medicaid, the program for low-income Americans into which 15 million Americans are going, a program which 50% of doctors won't see new Medicaid patients. It's like giving you a ticket to a bus when the bus only runs half the time. That's where many of these Americans will go. Or they'll go into the individual market, and the individual market will have higher premiums. Now the other side says, but there'll be subsidies for some of you, but the premiums are going to be higher. The health care costs are going to be higher. The majority doesn't want to explain why this bill changes the bipartisan agreement not to have federal funding for abortion that's been agreed to since 1977. They don't want to take time for the American people to understand the Class Act, the Long-Term Insurance Act, a new entitlement, which sounds wonderful, but the Democratic chairman of the Budget Committee described it as a Ponzi scheme worthy of Bernie Madoff. That is because the amount of money that would be paid in, a person pays a premium of $28.80 per year for 5 years, they'll have paid $14,000, and then they'll have a $1,500 benefit for a long time after that. Mr. President, it's obvious why the majority, thank you, Mr. President, it's obvious why the majority has cooked up this amendment in secret, has introduced it in the middle of a snowstorm, has scheduled the Senate to come in session at midnight, has scheduled a vote for 1 a.m., is insisting that it be passed before Christmas because they don't want the American people to know what's in it. It's a deeply disappointing legislative result, but our friends on the Democratic side seem determined to pursue a political kamikaze mission toward a historic mistake, which will be bad for the Democrats, I'm convinced, but unfortunately even much worse for our country. Thank you, Mr. President. I yield the floor.